Hello everyone. In this topic, today we are going to discuss about second gas effect. So what is the second gas effect? So initially, when you give a general anesthetic, let me say this is an alveoli. So when you give a general anesthetic, what happens is that this general anesthetic is mixed with the alveolar gases, right? So the concentration of oxygen or carbon dioxide which is present is usually decreased because now you are giving general anesthetic, right? So this naturally happens. Now when you give a more concentrated general anesthetic like N2O, okay, so here N2O is always given a concentration of 70 to 80%. So now what happens is that this N2O is also low blood soluble gas, so it can easily act. So the onset of action will be very fast. Okay, so now when you give this gas, what happens is that it can easily diffuse into the blood because its concentration is very high in alveoli and the concentration gradient is high, so it can easily diffuse into the blood. So here what happens is that usually the minute volume will be 500 ml. Let's say it is 500 ml. But here even 1 liter per minute of general anesthetic can enter into the blood. So this is exceeding this 500 ml value, right? So this is a significance. So now what happens when you give N2O, it can enter like 1 liter per minute, but usually oxygen can enter nearly only 500 ml. But here, due to its high concentration, it can easily enter up to 1 liter per minute, thus exceeding the minute volume value or tidal volume. Now let's see what happens and why it is called a second gas effect. So first, subsequent now what you're doing is you're subsequently administering other gas like halothane, which is usually given a concentration of 1 to 2% only. Now what happens, because you have before you have given 70 to 80% concentration of N2O, subsequent administration of other gas like halothane also causes increase in the diffusion. So this halothane is also now it is also sucked up by the blood up to like 1 liter per minute, right? So this is what is called as second gas effect. What does that mean, second gas effect? The first gas is the nitrous oxide, first gas. Second gas is halothane. Because of the effect of the first gas, second gas is also increasingly diffused, right? So this is called as second gas effect, right? Now what is, we're going to be studying one more thing. Now we are giving N2O, so after some point in time you have to of course discontinue the N2O because it is a general anesthetic, right? So now when it is discontinued, what happens is that because it is low blood soluble, it diffuses rapidly to the alveoli again. So from blood it diffuses back to the alveoli. So now what happens, thus O2 partial pressure is decreased in the alveoli, right? In the alveoli. So hypoxia will be result, right? So that is called as diffusion hypoxia. So this diffusion hypoxia can be prevented by administering 100% of O2 inhalation after discontinuation, after abrupt discontinuation of the N2O, and usually it doesn't causes any panic, but in normal individuals, in individuals whose cardiopulmonary reserve is normal, But when the cardiopulmonary reserve is disrupted or when it is low, then this diffusion hypoxia results. So for that patient, treatment is required. So it usually doesn't happen with any other general anesthetic, because usually other general anesthetic is less than 1 or even 0.5% only. Only for nitrous oxide we are giving a concentration of 70 to 80%. So this is about the second gas effect. So if you like this video, please like, share and subscribe to Rise and West channel. Thank you.